to proclaim August 25th through August 31st, 2024 as Community Health Worker Awareness and Appreciation Week here in Washington County. And to kick us off is the Director of Health and Human Services, Mira Samantel.
Well, thank you so much. Good evening, Chair Harrington, Board of County Commissioners. I'll only be up here for a moment, and then I'll step back to give room to our presenters. But as the Chair mentioned, my name is Mira Samantel. I use she, her pronouns. I'm the Director of Health and Human Services. I am thrilled to be here tonight. It's so fitting to be on the heels of the other proclamation. I'm to be presenting to you today a proclamation for the last week of August to be in honor of our community health workers. So Magdalena Ramirez is here at the end of the table to be able to introduce our guest speakers and to take you through a brief presentation and then a reading of today's proclamation. So I'll turn it over to Magdalena and our guests.
Thank you, and good evening, Board of Commissioners. Thank you for having us here. My name is Magdalena Ramirez. My pronouns are she, her, ella, and I serve here at Washington County as a Senior Program Coordinator for the Washington County Public Health. And today, our community health worker partners here are coming together with me to talk a little bit about our community health worker workforce and provide some awareness and appreciation in recognition of the National Community Health Worker Awareness Week. So I'll pass it on here so they can introduce themselves.
Good evening. My name is Ignolia Dyke, and I work for Virginia Garcia Memorial Health Center.
Hi, good evening. Crystal Tafoya, nice to meet you. My pronouns are she, her, ella. I'm a CHW with Adelante Mujeres. Thank you.
Good evening. My name is Soraya Uder, and I'm a community health worker. I started my career as a community health worker in 2008 as a volunteer, and I am presently employed with a nonprofit called Familias en Acción. Thank you.
Thank you. And we're here today to request your board to join us and with other jurisdictions across the nation in declaring the 4th week of August as the National Community Health Worker Awareness and Appreciation Week.
Is there a clicker on the table? It might have gotten moved or not put up. Guess what, folks? We didn't.
Okay.
Oh, we found it. One of you gets to drive now. Thank you.
Oops. There you go. Thank you. So in the interest of time, I'm not going to be playing the video that we have here, but I do encourage everyone that's here in person and online to visit our webpage to learn more about community health workers and where and how to find a community health worker here at Washington County. And I am going to invite Ignolia here to share the definition of a community health worker.
Yes, so the definition that I want to read is from the American Public Health Association, which defines community health workers as frontline public health workers who are trust members of an or have an unusual close understanding of the communities they serve. This trusting relationship enables community health workers to serve as a link between health, social services, and the community they serve, facilitating access to services and improving the quality and cultural competence of service delivery. Community health workers also build individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy.
Thank you, Ignolia. And as Ignolia shared with us in the definition, our community health workers, they address many social determinants of health, and we're here on these slides, we're listing of some that we are aware of that our community health worker staff here at Washington County and also within our community-based organizations and healthcare organization partners are providing. Just to name a few, including access to medical and dental care, maternal and child health and wellness, support with communicable disease prevention and mitigation. And Washington County recognizes the cross-sector work that community health workers do to address social determinants of health through partnerships that support systems navigation and community capacity across public health and health and human services. And Ignolia here is going to just share a little bit about our health literacy grant that just concluded in March.
So here we are representing a group of community health workers who were part of this Advancing Health Literacy Grant. So this grant actually highlights the work of the community health workers that have done for the community. So through an approximately $4 million Advancing Health Literacy Grant funded by the Office of Minority Health, a cohort of 12 community health workers were able to provide culturally responsive services and advanced personal health literacy to more than 41,000 residents of Washington County, facilitating culturally and linguistically appropriate services and access for COVID-19 tests, vaccines, and wraparound services to address food insecurity, unstable housing, utility support, and more during the COVID-19 emergency period and beyond. And as the slide show, the group also facilitate and coordinate services to 51,000 one-on-one direct support access to healthcare, 5,800 vaccines to community health workers coordinating vaccines events, and 17,000 COVID-19 tests were administered or distributed by funding CBOs. And in addition, the group created a health literacy training modules. This is a 4 modules training that where they provide input, everything was done through the lens of the community health workers. So with this model, is a model that highlight what is health literacy and how CBOs and healthcare system, as Virginia Garcia, we can improve the services and make sure that our patients not just come to our organization and just get out without knowing what it really happened during the time when they visit the doctor, but also they walk out with some knowledge and say, yes, what the doctor told me, now I understand. Or also because part of this module is being adapted in our clinic for providers to, I would say, to have a level of communication with our patients. So now they can use some words that are more understandable to our patients. So part of that module, also we have 2 community health workers who not just being provide input, but also to practice what they learned. For example, we have one of the community health workers hosting a table in one of our clinic, passing just information, telling people, what was your appointment about? Do you understand what the provider told you? Do you need any follow-up appointment? Let me help you to walk through the system. So no, we not just apply this one at the clinic, but also our other community workers in the different CBOs, they were able to practice the same thing.
Thank you, Gloria. And up next, we wanted to now go ahead and read the proclamation, and Soraya and Cristel are going to be reading that for us.
Proclamation, Board of Commissioners for Washington County, a proclamation in honor of community health workers for the last week of August, August 25th through August 31st, 2024. Whereas each year, the United States observes National Community Health Worker Awareness Week by celebrating the impact and contributions of community health workers, CHWs, to advance health equity. This year's national theme, Commemorate, Celebrate, and Collaborate, encourages all to celebrate CHWs, commemorate CHW achievements, and collaborate with CHWs as we work towards achieving health equity and justice. Today, Washington County will take the opportunity to recognize the work of CHWs in community-based settings. healthcare organizations, and within Washington County Health and Human Services. Their service has led to improved delivery of culturally and linguistically responsive services and advancement of health equity and justice across the Washington County, particularly during the COVID-19 pandemic, and now as we work together towards recovery and building resiliency. Whereas we recognize the community health workers are first and foremost a community-based workforce. As members and trusted leaders of the communities they serve, CHWs can connect and help community navigate and advocate for equitable services, many times due to their own shared lived experiences and commitment to change systems of oppression. Whereas we recognize that community health workers are a historic and diverse workforce, the CHW workforce is not a new profession. They have provided support and advocacy for their communities for centuries and hold essential roles as members known as tribal healers, advocates, community health representatives, promotores de salud, aunties, and outreach workers. Working and volunteering under many other titles, they carry out the work to advance health equity and build resilient communities. The CHW workforce is comprised of diverse backgrounds, such as gender, faith, abilities, language, culture, race, and ethnicity, with the majority of CHWs identifying as female and people of color who have endured racism and inequitable services due to systems of oppression. The diversity and shared experiences provide CHWs with a unique and trusting bond with their communities. They can utilize this trust as well as their training in health equity and advocacy to help communities connect and access resources and navigate complex systems. Whereas we recognize that community health workers are a cross-sector workforce, embracing a holistic approach to address social determinants of health and advance health equity. CHWs work across sectors, including healthcare, cultural and social supports, housing, justice, and education to help members navigate systems and advocate for equitable services. They leverage community strengths and assets, establish formal and informal networks, and build and strengthen individual and community resilience, all while providing culturally and linguistically appropriate services to all individuals and families they serve.
Whereas we recognize that community health workers are a proven workforce. Research studies from the past 60 years have demonstrated that CHW are not only effective at addressing the social determinants of health and key in advancing health equity, but also have a high return on investment and cost savings for healthcare expenditures. Whereas we recognize that community health workers are a precarious workforce. CHWs are primarily women of color, and many are immigrants and mixed immigrant status. Due to these intersections in identities, they often face oppression in both their personal and professional lives. As a community workforce, they have some of the lowest salaries across the public health profession. In addition, through their work, they are exposed to both direct and vicarious trauma, as well as hazards such as communicable diseases. In addition to inequitable salaries, there are often a lack of recognition and integration by medical providers and other public health professionals, as well as inconsistent funding for CHW programs. Despite these considerable challenges, the CHW workforce continues to show up to ensure that communities receive the equitable services they deserve. Whereas we recognize and honor the community health worker workforce as one that is unique, critical and essential to advance cross-sector strategies that help achieve health equity and justice for our communities in Washington County. Now, therefore, be it solved that on this 27th day of August 2024, the Washington County Board of Commissioners does hereby proclaim the 4th week of August each year as a Community Health Worker Awareness and Appreciation Week, and encourages all residents to commemorate, celebrate, and collaborate with community health workers. Thank you.
Well done reading the proclamation. Now, commissioners, what are the wishes of the board to proclaim this 4th week of August 2024 as Community Health Worker CHW Awareness and Appreciation Week in Washington County?
So moved.
Second.
We have a motion and a second. All those in favor, please vote by raising your hand or saying aye. Thank you, commissioners. Any opposed? The motion carries unanimously 5-0. Commissioners, before we go down on the floor for a ceremonial photograph, would any of you wish to make any comments? Let's do it. Everyone join us.
Thank you.